Hello everyone. It is a pleasure to be here today as we kick off this important series on preventive cardiology and rehabilitation. Over the next several weeks, we will be diving into exciting and vital world of cardiovascular health, focusing on how we can prevent heart disease and promote rehabilitation for those who are already affected. Heart disease continues to be one of the leading cause of death worldwide. But good news is that there are a number of proactive measures we can take to reduce our risk. That's exactly what we will explore today. We will explore how to prevent heart disease and how early intervention is important, how rehabilitation can prevent heart disease, can make a life-saving difference by all these things. That is what preventive cardiology. So what is preventive cardiology? Preventive cardiology is the branch of cardiology focused on reducing the risk factors, preventing cardiovascular diseases, and promoting long-term heart health. We often hear about heart attack, stroke, and other heart-related illness, but many of these issues are preventable. Preventive cardiology is all about taking action before these problems arise and working to stop them from developing in the first phase. We will be talking a lot about the major risk factors during this series. Things like high blood pressure, high cholesterol, smoking, poor diet, and lack of physical activity and stress. These are all factors we can address through lifestyle changes and medical interventions. The focus here is on primary prevention, which is aimed at preventing heart disease before this happens. But what if heart disease has already developed in someone's life? This brings us to the second major focus of this talk series, that is called secondary prevention through cardiac rehabilitation. So basically, what is cardiac rehabilitation? Cardiac rehabilitation refers to a comprehensive program designed to improve the health and well-being of a people who have experienced heart disease, heart surgeries, cardiac event such as heart attack. Rehabilitation helps individuals to recover physically, emotionally, and also mentally. After the heart attack, coronary artery disease or coronary artery bypass surgery or heart procedure, cardiac rehab plays a crucial role in recovery. It involves supervised exercise training, nutritional counseling, psychological support, and education on how to manage heart disease in long term. Goal of the rehabilitation is not only to help people recover physically, but to also empower them to manage their condition, reduce the risk of another event, and improve their quality of life. In this series, we will explore how rehabilitation can help to reduce the risk of future cardiac events, improve exercise tolerance, and reduce symptoms, and also to enhance mental well-being. You will see how structured rehab programs work, the evidence behind their effectiveness, and how they are tailored to each patient needs. The importance of lifestyle changes. Both preventive cardiology and cardiac rehabilitation emphasize the significance of lifestyle changes. As we all know, the exercise, diet, and stress management are key pillars of cardiovascular health. The earlier we begin to focus on making heart healthy choices, the better our outcome will be. The most important thing is exercise. Regular physical activity helps to reduce the risk of heart disease by improving cardiovascular circulation, lowering blood pressure, reducing cholesterol level, and also maintaining a healthy weight. The second important thing is nutrition. A heart healthy diet rich in fruits, vegetables, whole grain, lean protein, and healthy fats can reduce cholesterol level, blood pressure, and also overall risk of heart disease among general public. Most important is stress management. The chronic stress is one of the significant risk factors for cardiovascular disease. Learning how to manage stress through relaxation techniques, mindfulness or therapy is an essential part of both prevention and rehabilitation. Why this series matters? Preventive cardiology and cardiac rehabilitation are not just important for people who are already dealing with heart disease. They are for everyone. Even if you have not experienced a cardiac event or don't have known risk factor, the knowledge shared in this series will be valuable to help you make informed decision about your health. Moving forward, as we progress in this series, we will touch on many more topics like understanding your cardiovascular health and knowing your numbers, things like cholesterol, blood pressure, and blood sugar. Exploring the role of medication in the prevention and rehabilitation, like cholesterol medications, diabetic medications, and implementing exercise plans and guidelines specific to cardiovascular care. The mental and emotional aspect of living with heart disease and coping strategies, all this together, we will not only learn the science behind heart disease prevention and rehabilitation, but we will also gain practical, actionable tool to implement in our own lives and support others on their journey to a healthy heart. Looking forward, as we continue with this talk series, we encourage you to actively participate, ask questions, and share your experience with your friends and loved ones. Heart health is a lifelong journey, and we can all benefit from continuous learning and support. Whether you are here as a patient or healthcare provider or someone simply interested in improving your health, you are making an important step towards healthy heart. By the end of this series, I hope you live with a greater understanding of how to prevent cardiovascular disease and how to manage it if it is arise, and how rehabilitation program can guide people to healthier and longer lives. Thank you for being here today, and I look forward to learning and growing together as we embark on this important journey of improving heart healthy for all. Thank you.